This week's Ask Dr. Durie is actually a pretty common question and concern, which comes from a patient who is worried about the fact that with one cycle of combination chemotherapy or therapy involving several drugs, the myeloma protein didn't come down or just came down very, very slightly. And so this is a very common concern where obviously we would be wanting to see the myeloma protein coming down right away with even one round of treatment, and that the protein would steadily be coming down with each further cycle. However, as you start treatment for myeloma, it's important to keep in mind that the protein level is going up rapidly frequently. And so, as it turns out, stabilizing or staying at about the same level does frequently represent improvement, because you see without the treatment, the protein level would probably have continued to go up maybe by 1, 2, 3 grams. And so stabilizing can often be a very key first step towards ongoing and further improvement. So key point, do not panic. This is something which does happen, and it's not sufficient to say, oh gosh, the treatment is not working. The ongoing therapy, of course, we would be expecting the myeloma protein to come down after that first cycle, and so improvement in the second and third cycles. And so without panicking, if there was no improvement after 2, 3 cycles in particular, then we would want to review and decide what is best. So bottom line, very, very important to discuss carefully the results of your myeloma protein levels and other tests during those first 1, 2, 3 cycles, and then just decide together what is the best strategy. One point to emphasize is that if you get a protein test result that comes back and it seems a little bit strange, maybe completely out of line, well, sometimes the lab can make a mistake. And so it's important to just be ready to repeat a test if necessary, if it seems like a crazy result. But if you do have confirmation that the numbers are not coming down, that is, without panicking, a time to carefully sit down and review your options and see what could be a best next step. With the good news being that we do fortunately have quite a number of options, and chances are that there can be a good and safe and effective alternate option.